Depression Among Adolescents by Shefali Chaudhry. How does depression affect teenagers? This is a guide to the signs, symptoms, and effects of depression in adolescence. So, understanding teen depression. Teen depression is a serious mental health problem that causes a persistent feeling of sadness and loss of interest in activities. It affects how a teenager thinks, feels, and behaves, and it can cause emotional, functional, and physical problems. Findings show that 1 out of every 8 adolescents has teen depression. Although depression can occur at any time in life, symptoms may be different between teens and adults. The environment a teen grows in can lead to issues such as peer pressure, academic expectations, and changing bodies. These bring a lot of ups and downs for teens. But for some teens, the lows are more than just temporary feelings. They're a symptom of depression. What are the symptoms of teen depression? From the changes of puberty to questions about who they are and where they fit in. With all this drama, it isn't always easy to differentiate between depression and normal teenage moodiness. Teens with depression do not necessarily appear sad, nor do they always withdraw from others. For some depressed teens, symptoms of irritability, aggression, and rage are more prominent. Following are a few of the many symptoms and signs of depression in teenagers. If you're unsure if a teen is depressed or just being a teenager, consider how long the symptoms have been present, how severe they are, and how different the teen is acting from his or her usual self. Effects of teen depression. The effects of teen depression are real and can be detrimental. These effects can cause lasting physical and emotional problems for teens. Depression can cause low energy and concentration difficulties, resulting in problems at school. Teens often turn to alcohol or drugs in an attempt to self medicate their depression. Or, teens may go online to escape their problems, but excessive computer use only increases their isolation and makes them more depressed. On the other hand, depressed teens, like boys who might be victims of bullying, might become more violent and defensive. Teen depression goes hand in hand with other mental problems like eating disorders and self injuries. So, this is where I'm going to explain how cyberbullying and depression go hand in hand. Cyberbullying on social media is linked to depression in teenagers. For example, in 2013, a lot of suicides were linked to the social network called Ask.fm. The death of teens who had been found to be abused on this site promoted Ask.fm to launch new safety measures to filter out abusive and bullying content. There are a lot of studies covered by a variety of social media sites that show the significance of the connection between cyberbullying and depression. How is teen depression diagnosed? There aren't any specific medical tests that can detect depression. Healthcare professionals determine if a teen has depression by conducting interviews and psychological tests with the teen and his or her family members, teachers, and peers. The severity of teen depression and the risk of suicide are determined based on the assessment of these interviews. Treatment recommendations are also made based on the data collected from the interviews. The doctor will also ask for other signs of potentially coexisting psychiatric disorders such as anxiety or substance abuse. One of the most vulnerable groups for completed suicide is the 18 to 24 year age group. How is teen depression treated? Depression is very damaging when left untreated, so don't wait and hope that symptoms will go away. If you see depression signs, seek professional help. Family therapy may be helpful if family conflict is contributing to a teen's depression. If you have questions or concerns, discuss with your healthcare provider. Furthermore, you can ask your doctor to refer you to a psychologist who specializes in children and adolescents. Antidepressants were designed and tested on adults, so their impact on the young and developing brains is not yet completely understood. So it's important to weigh the benefits against the risks before starting your teen on medication. Warning signs of suicide with teen depression. Teen suicide is a serious problem. Adolescent suicide is the second leading cause of death following accidents among young youth. Teen depression often makes problems seem overwhelming and the associated pain unbearable. Suicide is an act of depression, and teen depression is often the root cause. When Nothing Matters Anymore. When Nothing Matters Anymore is a survival guide for depressed teens. It's a light, informative reading that is full of resources and suggestions that are sure to help many suffering teens. It emphasizes the importance of setting small goals over short periods of time to help you feel in control of your life. So, how can parents help avoid or decrease teen depression? There are some effective parenting and communication techniques you can use to help lower the stress level for your teenager. When disciplining your teen, replace shame and punishment with positive reinforcement for good behavior. This follows Skinner's experiment with rats, where he discovered that rewards are more effective than punishments. Allow your teenager to make mistakes. Overprotecting or making decisions for teens can be perceived as a lack of faith in their abilities. This is a reflection of Adler's idea of the two damaging parenting styles, pampering and neglect. Lastly, try to avoid telling your teen what to do. Instead, listen closely, and you may discover more about the issue causing the problems. Therefore, depression is something major that affects teenagers around us every day. It's important to understand the significance of the problem and using the right measures to tackle it. To conclude, this is a link to a video by teenmentalhealth.org summarizing the impact of depression on a teenager's life.